and today we're going to be tackling a big topic, one that as part of my medical practice is the number one question I get from my patients, and it's on the value using testosterone replacement therapy for males starting in their 40s and beyond. So currently we are witnessing an unprecedented era in the study of testosterone. In the last year or so, we have seen the release of the most extensive, randomized, placebo-controlled study to date, examining the effects of testosterone on cardiovascular and prostate health. The initial impetus for this research stemmed from concerns over cardiovascular health. Prior to 2010, existing research hinted at testosterone's potential to guard against cardiovascular disease without indicating a heightened risk for cardiovascular incidents. But as part of my medical education, we were always taught that being a male conferred a heightened risk of a heart attack compared to a female by about 10 years. It was thought either that testosterone was giving this added risk or perhaps estrogen in females was providing a protective effect. And then, between 2010 and 2014, 4 studies emerged suggesting a possible increase in cardiovascular event risk. And these studies, however, had significant limitations, including a lack of randomizations and placebo controls. Nevertheless, in September 2014, the FDA expressed its intention to delve deeper into these concerns. And following their deliberations, 2 major outcomes were announced. By 2015, a significant amendment was made to the labeling of all testosterone products, highlighting that the long-term clinical safety of testosterone remains undetermined. The call for more extensive trials was clear, as conclusions regarding testosterone safety in relation to cardiovascular disease remained elusive. And so a significant directive from the FDA was a mandate for testosterone product manufacturers to undertake a comprehensive clinical trial to affirm the safety of testosterone. And this directive led to the initiation of the TRAVERSE trial in 2015.